Good morning to you. Welcome to another edition of WLOX's Expert Alert. I'm your host, Jim Tabor, and this is where we have experts from different areas of businesses along the Gulf Coast and talking about things that are going on in their field. Today we have Sunny Elmer, who is the office manager, marketing director with Integrative Medical and Wellness in Gulfport, and soon to be moving to Biloxi.
Yes, sir.
In about a month. Welcome to the show.
Thank you.
For those of maybe tuning in for the first time for this, excuse me, give me a little background on Integrative Medical and Wellness Center.
So we're family practice. We do have a board certified nurse practitioner who is certified in family medicine. Mm-hmm. So basically we see anybody with high blood pressure if they need to be monitored for that or given medications, diabetes, cholesterol. We do wellness visits, sick visits. So we see pediatrics, up to seniors. So any age group we will see and treat. We're accepting new patients. Typically we can get a new patient in about the same day as long as your insurance covers it. Mm-hmm. We will see walk-ins. We do also see self-pay as well if we have the availability.
Okay. Now as far as wellness, people needing their yearly checkups. Mm-hmm. Physicals, things like that.
Yes.
I know there's some businesses that require that on a regular basis,
mm-hmm.
But it helps towards their insurance as well.
Right. We also have the flu vaccines. We do offer the flu vaccinations. You can just come in and request one. It is covered by your insurance. We do also have cash pay options for that if you don't have insurance. Mm-hmm. We can see a patient for a flu vaccine as young as 7 years old.
Wow.
And then we do have the higher dose for patients that are a little more susceptible of getting the flu for 65 years and plus.
Okay.
The insurance does cover the higher dose as well.
Now, I noticed you also have a lot of people need that extra boost of energy or something.
Right.
B12 shots.
Yes, sir. We all need some B12 in our lives. A lot of people want to know the difference between B12 over the counter and the injectable B12. The B12 over the counter has a lot of other additives in it. Mm-hmm. The injectable B12 is actually injected and it's dispersed a lot faster into your system than the B12 pills.
When you get a B12 shot, it's like within minutes. It's
like, you're just like,
whoa, I'm ready to take on anything.
Right.
You see on the screen there a lot of information on the
mm-hmm.
on your website that you have. COVID testing.
Yes. We're still offering COVID testing. We do still have the rapid test. Mm-hmm. We also have the nasal swabs, which we do highly recommend if you're symptomatic is a nasal swab because that is the most efficient. And
it's like 95% or something like that.
Right. Yeah. But if you do just want the rapid test, that's fine. We do offer that.
Blood work?
Yeah. We do, the finger prick, the blood, 15 minutes.
That's what I did when the first time when I first came back from vacation in Jamaica. I came over there that Monday morning and got that, and, mm-hmm. and I was negative but asymptomatic.
Right.
Then, which was a surprise. So evidently, at some point in the year earlier, I'd had it and never knew it. Mm-hmm. And I'm sure there's a lot of people, and there's more and more people have talked about. There's probably so many of us that have had it and didn't know it.
Right. You can get your antibodies tested. Everybody's a little different about how long they hold the antibodies in their system. It could be 3 months, 6 months. We've kind of seen that. We do offer antibody testing itself. It's mm-hmm. a blood draw. We send it to the lab. Within about 24 hours, you'll get your results back to see if you've had the antibodies. Again, it just depends on your body if it's how long they stay there.
Now, once you've had the antibodies, can you catch it again?
You can. You can catch it again. They say it's not as
common.
Not as common, and it won't be as rough the second go round because you have the antibodies there.
Okay. Mm-hmm. All right. Let's talk a little bit about medical weight loss. Mm-hmm. Y'all have a special program for that.
We do. Yes. You'd come in and see our nurse practitioner, Brandy. We'd get your weight, which I know nobody likes their weight taken, especially women. But we'd get the initial weight based off of your BMI, and if you're a candidate, we typically she'll write a medication for you for your weight loss. Mm-hmm. You do have to be seen monthly. She does provide some foods that are beneficial to weight loss, and she'll go over all that when at your appointment. But we do recommend a monthly follow-up. We'll do your weight, kind of keep on track with you how you're doing.
Explain what BMI is, because I know there's people out there wondering, okay, what is, I hear this terminology all the time. What is BMI?
Right. So we all kind of want to know how much we are supposed to weigh, and it goes by your height to weight ratio. So if you're
Does age come into play?
Doesn't come into play with it. It's more of your height. So if you're 4'11" or 6'4", the weight that you are scientifically supposed to be is what averages your BMI. So if you're over that weight that they say that you're supposed to be at that height, then that means.
I often wonder about some of these football players that are like 6'4", 300 pounds. And I'm thinking, okay, how much of that is fat and how much of that is muscle?
Exactly.
I guess it knows the difference.
It does. So there are scales which we are going to get that do read the difference between what's muscle and what's fat. We don't have it just yet, but when we move to our new location, that is something that we'll be having in the office.
Okay.
Is the actual scale to determine what's what. And that's always good to know too, especially with bodybuilders and everything.
Well, speaking of athletes, and not only athletes, but a lot of us as we get older, we have problems in our joints, and you all do steroid injections.
We do, yes. So you can come in anywhere if you have a shoulder pain, knee pain, hip pain even. Dr. Barr he used to practice orthopedic surgery. He knows all about the joint spaces, and he's the one who would be doing the joint injections. If you have any inflammation, which if you decrease the inflammation, that does help with the pain.
Right.
So you just give a steroid injection in the space where it hurts, and typically, you come in and do that. I want to say it's every 3 to 6 months.
Oh, wow. That's good.
And it relieves it for about 6 to 8 weeks.
Oh, that's awesome. Regenerative meds for men and women. We're talking basically about sexual health here.
Yes.
This is something else that y'all are working with now.
Yes, we are. That is something that's up and coming. We should be getting the equipment soon in about a week or two. This is going to be something that it's non-surgical. If you're just tired of taking pills, the pills aren't working. That kind of messes you up too, because you have to say, hold on a second, let me take my pill first.
And then wait for a little while before you take it back.
Right. If you don't want to have to do all that anymore, there's no clunky devices. You come in, it's called a Zimmer. It's a shockwave therapy, and it could be for men and women, and it just helps stimulate what you've lost. It helps stimulate that area. It is a series. It helps stimulate the blood flow. Yes, sir. So there's a series. It's not painful at all. And then what we would do is have them call, just mention the word about having some issues in the bedroom. We get them on the phone with an expert, get them scheduled for their appointment, and just kind of go over their treatment options and how many we recommend and what we recommend.
Now, is there a charge for an evaluation for that?
There is that you would see the provider first, so that's covered through insurance, but it is a self-pay treatment.
No, you're talking about your provider. I would see my provider and get a recommendation.
Well, you would see Brandy, our nurse practitioner.
Okay,
yes.
all right, and then after an evaluation, then you would decide as far as the treatment for that.
Right, and the packages.
And the great success rate on this?
Oh, absolutely. We've been through a lot of training. So we just recently went to our last training about a month ago, and every patient that we saw that day walked out with a smile on their face, believe it or not, even the location. And husbands are happier, wives are happier, and they don't have to remember to take a pill, and you don't have to worry about.
It's more instantaneous.
Right. You don't have to worry about the awkward surgeries, that men have to go through if they're having any trouble, but it brings you back to what you used to be, basically, is what we're trying to do.
Wow.
Get you back to where you used to be, and it works. It fixes the problem.
That's great. Talk a little bit about hormone replacement therapy, and if you would, we got a minute or two left.
Okay. So we do BioT. What it is, it's a pellet that's injected into your soft tissue. So it helps if you have, again, low libido. So we're kind of wanting to promote that with our sexual health too. If your hormones are off balance, your sexual health is not well either. So it helps with low libido. It helps with your mood. It helps with being tired. You'll get increased energy. It's all about how your body's balanced, and these pellets actually help balance out your hormones. And when your hormones are balanced well, you're balanced well, you're
balanced.
happier.
Can't beat that. Well, phone number's on your screen, and we know, and sometime in March is when you're going to be moving to Biloxi.
Yes.
So you'll be in here before
Still on
that.
Pass Road, so we won't be too far from where we are now.
There you go. And anyway, if you'd like to make an appointment or stop in, 248-0561, I believe it is.
Yes, sir.
All right, that's Integrated Medical and Wellness Center on Pass Road in Gulfport. Thanks for being here with us today on Expert Alert.
If you have a question for any of our experts, go to WLOX.com and click on Expert Alert. For a list of any of our upcoming experts, go to WLOX.com and click on Expert Alert.